Factors contributing to male infertility. Welcome to the video, guys. I hope you are doing well. People consider males the weak link in the reproductive chain regarding fertility issues. However, sperm abnormalities are not necessarily the cause of the problems with a couple's ability to have a child. In fact, the male spouse is the only culprit in almost 40% of all cases of infertility in couples. Infertility in men may be caused by a wide variety of circumstances, including the choices they make in their lifestyle, the drugs they use, and their health issues. In this video, we will investigate many of the factors that are responsible for the majority of cases of male infertility. 1. Options for living one's life. Altering your lifestyle in some ways might have a detrimental effect on the quality of your sperm. Guys who smoke, for instance, have a greater risk of having lower sperm counts and motility than guys who don't smoke. Problems with fertility are another potential outcome of heavy alcohol use in males. Men who spend much time in heated environments, such as saunas or hot tubs, may also have a lower sperm count. It may happen when the body is subjected to high amounts of heat. 2. Medications. In males, reproductive issues may also be caused by the side effects of several drugs. Some chemotherapy medicines, for instance, used to treat cancer, might be harmful to the generation of sperm. In addition, treating some illnesses, such as high blood pressure or depression, using certain drugs, which may be used to treat other disorders, may also affect the health of sperm. 3. Disorders and ailments. A variety of health issues might result in a man's inability to have children. For instance, the risk of reproductive problems increases in males with testicles that have not yet descended. In addition, males who have a history of sexually transmitted infections, STIs, have a higher probability of experiencing reproductive issues. 4. Hereditary problems. Several hereditary problems may result in male infertility. For instance, men with Klinefelter syndrome have an extra copy of the X chromosome, which may result in deficient testosterone levels and a reduction in the generation of sperm. In conclusion, a wide variety of variables have the potential to contribute to male infertility. You must see a medical professional if you are worried about your ability to conceive children. They will be able to evaluate your unique circumstance and guide you on the steps that would be most beneficial.